Cerebral palsy in ICU, BIPAP, tracheostomy and evidence-based home care with 24-hour intensive care nurses with intensive care at home. So I want to welcome you to another YouTube live stream from intensivecarehotline.com and intensivecareathome.com. My name is Patrick Hutzel, critical care nurse and founder of both services, intensivecareathome.com and intensivecarehotline.com, where we help families of critically ill patients in intensive care to make informed decisions, get peace of mind, control, power, and influence, making sure your loved ones always get best care and treatment. And obviously with intensive care at home, we are providing services at home, predominantly for long-term ventilated adults and children with tracheostomies, but also for adults and children on BiPAP and CPAP without tracheostomy, tracheostomy care without ventilation, cough assist management at home, ventilation weaning management at home, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, PICC line, central line, Hickman's line, port management at home, nasogastric tube, nasotracheostomy tube, PEG, PEG tube management at home, as well as palliative care services at home. So today we'll be discussing cerebral palsy in intensive care, as well as the discharge process to intensive care at home, which is often what is needed to not only keep clients, cerebral palsy clients, alive, and also give them quality of life, or in some instances, quality of end of life. Today, we discuss about what you need to know if your loved one is critically ill in ICU, how we can help you there, but also how we can help you to take your loved one home safely with 24-hour intensive care nurses. Now, before we dive into the subject, I've worked in critical care nursing for over 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. I've been consulting and advocating for families in intensive care here at intensivecarehotline.com since 2013, and we've been consulting and advocating for families in intensive care all over the world. I'm also the founder and managing director of Intensive Care at Home, and with Intensive Care at Home, we're sending our critical care nurses into the home 24 hours a day. With Intensive Care at Home, we are currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We're also providing level 2 and level 3 NDI support coordination, as well as TAC and WorkSafe case management. Today, we'll be spending the first 30 minutes focusing on cerebral palsy in hospitals and ICUs, and then we'll move to how intensive care at home provides evidence-based high-quality care at home, including BiPAP, tracheostomy, seizure management, all delivered by 24/7 critical care registered nurses at home with intensive care at home. Also, I want to welcome our viewers on replay. I know a lot of people can't make it to the live, but they watch this on replay, so I want to acknowledge your attendance here as well. If you are here live, type your questions into the chat pad, or connect with me live here on the StreamYard link by clicking on the StreamYard link. I'm posting the StreamYard link into the chat pad. Also, if you like my videos, subscribe to my YouTube channel, click the like button, click the notification bell, comment below so that I can make the content that you want me to make. So let's go to the first segment, and let's look at understanding cerebral palsy and ICU admissions. Cerebral palsy, also known as CP, is a neurological condition that affects movement, muscle tone, and coordination. Many children and adults with CP eventually end up in ICU due to respiratory failure, pneumonia, aspiration, or seizure, or a combination of all of it. And I've seen it over and over and over again, not only since I worked in ICU and looked after thousands of critically ill patients and their families, but also in home care with intensive care at home. And by the way, I've been working with intensive care at home in 2 different countries. Not only was I part of launching intensive care at home in Germany, I also launched it here in Australia since 2012. So I come from a, decades long, I can talk about decades long experience with intensive care in ICU, but also with, decades worth of intensive care at home experience. So to combine both worlds, you need to understand both worlds inside out. And I do believe I have the ability to understand both worlds inside out. So, to combine both worlds and make sure that our clients get what they need, whether it's in intensive care when we consult and advocate, when we review medical records, or whether it's at home when it comes to setting up intensive care at home, when it comes to the funding, when it comes to creating a team at home, because that is critically important, the selection of the right team. So when cerebral palsy patients go into ICU, when that happens, they often need BIPAP ventilation, CPAP ventilation. Sometimes they need intubation and mechanical ventilation, which could easily lead to a tracheostomy. Unfortunately, families are often told that the ICU is the only option, but that is certainly not true, and that's what we will be talking about today. Another treatment form, especially when it comes to respiratory issues with cerebral palsy clients, is obviously the ERVO, high flow nasal cannula or high flow nasal prongs. That's also a more and more common treatment option when it comes to cerebral palsy and the respiratory issues that unfortunately go hand in hand with it. So when an adult or a child goes into ICU with cerebral palsy, as we all know, ICUs are designed for short-term stabilization, certainly not for long-term quality of life. Adults and children with cerebral palsy are often much safer and better off at home with 24/7 specialized ICU nurses, and I'll explain that, obviously, as we go along today in this live stream. So, in many ICUs, patients with cerebral palsy are placed on BiPAP or CPAP ventilation to begin with for respiratory support. Some eventually need a tracheostomy if long-term ventilation becomes necessary, if BiPAP or CPAP are no longer, working because of, let's just say, aspiration risk, right? And many cerebral palsy clients, especially when they were born with the condition, also have a fundoplication, which minimizes, if not excludes, aspiration risk. And that might be one way to prevent a tracheostomy. It's not the only way, but sometimes a tracheostomy is necessary because patients also can't keep their airways open for a number of reasons. So when long-term ventilation becomes necessary, then a tracheostomy becomes necessary. Now, some ICUs might flat out tell you that a tracheostomy will not be in your loved one's quote-unquote best interest, and that it's actually quote-unquote in their best interest to stop treatment and letting them die. Well, nothing could be further from the truth. I would want you to talk to some of our clients that have been living at home with cerebral palsy for years with the right level of support. They want to live, they have community access, they live with family. It's the right environment for the right patient. And that's what ICUs don't know. They just have such a limited point of view most of the time. They do not understand the leverage points between ICU and intensive care at home. They do not understand that stable teams, for example, in the community that we provide makes all the difference, because in ICU, you've got, people coming and going, whether it's doctors or nurses, and when families come to us, they're very frustrated by that, but they're not telling ICUs that because they don't want to upset the ICUs. But the bottom line is, that's the reality of an ICU. Nobody wants to look after the quote unquote long-term patient, because they're often being seen as a nuisance, whereas we don't see our clients or our patients as a nuisance. We see them as a client or as a customer. We want to engage with them. We want to work with them. We want to help them. They are what we specialize in. Come to us. We believe we understand you. We understand your needs, right? We understand your need to be understood. We understand your need that you've been traumatized by hospitals. We understand your need that you need to be able to engage with people in a safe environment. And I know that you don't perceive ICU as a safe environment because, the doctors and the nurses might make you feel as if they're judging you because of the choices that you have made for your loved one, right? And you are well within your rights to make those choices for your loved one. So let's come back to the clinical. Obviously, managing BIPAP or tracheostomy for a patient with cerebral palsy requires 24/7 critical care nurses. Definitely not general nurses, right? Or let alone support workers or carers, right? That would be a death sentence. And I'll come to that in more detail as we go along, that when general registered nurses or carers, support workers are looking after cerebral palsy, BIPAP, CPAP, tracheostomy in the community, that people have died because of it. And I will come to that later. So why is that? Why do they need to go into ICU? And if they go home, why do they need intensive care at home? Because, as you would well know, the patients can desaturate, have airway blockages, or seizure-related respiratory arrests at any time. Only an ICU-trained nurse can handle these emergencies safely. Unfortunately, many hospitals try to wean too early or not at all, discharge too soon, or try and push families towards palliative care instead of offering ongoing treatment and long-term home ventilation options, either on BiPAP or on CPAP or with a tracheostomy. And that's where exactly intensivecareathome.com steps in, right? You also need to understand that with the right, not only with 24-hour nursing at home, also with the right medical cover at home, with an intensive care specialist or respiratory physician, pretty much the ICU can be brought home very safely so that patients can be at home predictably. Next, seizure management in ICU. Seizures are quite common in patients with cerebral palsy and are a regular occurrence, and are one of the main reasons for ICU admission. Seizure management in ICU requires constant observation, airway management, and sometimes ventilation support. Now, imagine how overwhelming this is for families watching their loved ones sedated, intubated, and surrounded by alarms and by the negativity of ICU teams. But here's the good news. Seizure management and ventilation, invasive, BiPAP, CPAP, or non-invasive with a tracheostomy, or non-invasive on BiPAP or on CPAP, can be safely done at home with 24/7 ICU nurses who are trained to recognize and respond to seizure activity immediately, preventing unnecessary ICU admission. So again, this is where evidence-based care at home comes in. Hospitals are all about evidence-based care. Well, it's the same for us. So we provide services at home according to the evidence-based mechanical home ventilation guidelines. And I encourage you to go to our website at intensivecareathome.com and have a look at the mechanical home ventilation guidelines, because they're evidence-based and they clearly say that exclusively critical care nurses with a minimum of 2 years critical care nursing experience can safely provide care at home for ventilation, tracheostomy, whether it's invasive or non-invasive ventilation. But even if it's tracheostomy only, without ventilation, even then, a critical care nurse is needed 24 hours a day for tracheostomy patient with cerebral palsy. It's so important that we always stick to the evidence, right? If support workers at home would be evidence-based, well, I've yet to wait for a research paper to say that. Because that is like flying the airplane with a cabin crew instead of the pilot, right? Again, it's like flying the cabin crew it's like flying the airplane with the cabin crew instead of the pilot. We know how that would end. And again, I will talk more about, unfortunately, patient deaths later in the community because they were looked after, on ventilation, tracheostomy, BIPAP, CPAP, with support workers instead of intensive care nurses, and that patients have died. So, before we move into home care discussions, it's important to understand that ICU is not a place for long-term care. Prolonged ICU stays increase the risk of hospital-acquired infections, pressure injuries, deconditioning, delirium, ICU psychosis, emotional trauma and mental trauma for patients and for families. At home, infection risk is much lower, and patients enjoy privacy, comfort, and dignity. Like I said, I believe we have created a safe environment for our clients to not feel judged about whatever they've experienced in ICU, because most families that come from ICU are extremely traumatized, but they're not sharing that with the ICU because they don't want to feel judged. They don't want to be, they don't want to they don't want to jeopardize the relationship that they've got with the ICU, right? And let's now talk about how intensive care at home makes a transition from ICU possible safely, effectively, and for any funding body most cost effectively as well, right? And the other thing that I've learned over the years is, when I talk to clients directly that are at home already, every time I'm talking to clients, it's almost this begging, where they're saying, we never want to go back to ICU ever again. And who can blame them? Who can blame them? Who can blame our clients for wanting to be at home? Right? So let's now look at, intensive care at home for cerebral palsy at home. And before we go into the deep dive there, also let me say, when patients have, or cerebral palsy patients in particular, have seizures, right? Uncontrolled seizures, grand mal seizures, tonic-clonic seizures, sometimes even absent seizures, it needs a seizure management plan. And those seizure management plans, I can tell you, usually include giving off benzodiazepines like diazepam or midazolam, also known as Versed, if you're watching this from the US. Right, midazolam is called Versed in the US. Now, with that comes a high level of skill that is needed, right, to manage grand mal tonic-clonic seizures, also to prevent them. But as soon as there's benzodiazepines involved, such as diazepam, midazolam, sometimes there's opiates involved, such as fentanyl or morphine in seizure management plans, right? It needs a critical care nurse, because those medications, diazepam, midazolam, fentanyl, morphine, are most of the time given in ICU, and it's the same at home, at such doses that patients can stop breathing because of those doses needed. And if someone stops breathing, you need a nurse there that can manage an unstable airway, because that's what it is. If someone stops breathing, that's considered an unstable airway. Once again, with intensivecareathome.com, we operate under evidence-based mechanical home ventilation guidelines, which you can find on our website. Also, we are the only service provider in Australia in 2025 that has actually achieved third-party accreditation for intensive care at home nursing. There's no other service provider in the country that has the policies, procedures, and the intellectual property that we've built over the years for intensive care at home. So our guidelines and policies and procedures are built on best practice standards for home ventilation with tracheostomy, BIPAP, CPAP, and seizure management. Our intensive care at home model has been proven safe, effective, cost-effective as well, and life-changing for patients with cerebral palsy who are ventilated and or tracheostomized. In fact, it's the same level of care as ICU, but delivered in the comfort and safety of your own home. So keep that in mind, that we can do at home, in comparison to what you are getting right now in ICU, right? Also, we have medical cover. Some of it depends a little bit on the location, but most of the time we can, provide medical cover as well, which is obviously necessary. But sometimes we're also happy to work with the discharging hospital, of course, to get medical cover. You can bring your own medical cover if you like, if you have the ability to do so. I know that if you're watching this, you have already thought outside of the box, so to speak. And I know you have thought already, what you can do for your family member to go home if you're stuck in ICU. So again, our model has been proven to be safe, effective, and life-changing for patients with cerebral palsy who are ventilated and or tracheostomized. In fact, if the same level of ICU care, but delivered in the comfort and safety of your own home. Again, keep in mind, there's also much less infection risk at home. So in an ICU, there's a super high infection risk simply because, there's so many other patients in ICU that are infectious. And you might not be in close contact with another patient, but the reality also is that doctors and nurses going, and physios and OTs and, even support people in ICU, such as ward support or, orderlies, when they go from patient to patient and they're not washing their hands properly and they're not changing aprons, for example, right? The reality is that your loved one will be at much higher risk of infections than at home because you're not surrounded by sick people at home, right? Also, another big aspect for home care is that's not talked about as much because ICUs are so far removed from the reality of intensive care at home, right? You can have your pets at home. Now, tell me, for anyone watching this that, has had a family member in ICU or has been in ICU themselves, maybe not necessarily long term, but, you have pets at home. Now, you can't tell me you're not missing your pets, let alone you're missing your family members, of course, but pets are actually therapeutic, right? Whether it's the cat or the dog at home or both, they are very therapeutic. And, whilst I understand that there's different, again, infection control standards in ICU than there are at home, maybe bringing a cat or a dog into ICU every now and then will help with recovery. Your pets are very affectionate, we know that, and they can help with healing. They can also help with healing trauma. So now let's look at the role of 24/7 critical care nurses at home. And this is pretty much the foundation of what we do with intensive care at home. 24/7 intensive care nurses providing care at home for patients with cerebral palsy on BiPAP or CPAP ventilation, with or without tracheostomy. Now, some of our cerebral palsy clients at home are ventilated with a tracheostomy on SIMV, for example, or on ACV, right? We talk about regular seizure management, also talk about PEG feeding, suction requirements, giving nebulizers, using high-flow nasal prongs or the airvo when needed, which is basically humidified air or humidified oxygen, using cough assist when needed and if needed, right? And be prepared for, in the unlikely event of an emergency, suctioning, tracheostomy blockage, and so forth. So only critical care nurses have the skill set to maintain airway safety, manage ventilators, respond to emergencies, change tracheostomies at home, and prevent ICU readmissions. We've had many clients successfully discharged home from ICU with cerebral palsy, but of course also with other conditions. Manage ventilators, manage tracheostomies, respond to emergencies, and prevent ICU readmissions. And we've had many clients successfully discharged home from ICU and living safely with their families, sometimes for years, with, quality of life restored, with community access, surrounded by their families, right? Some of our clients even go back to work if they have a job that they can work from home or work with a computer, some even with an eye gaze computer. So, whenever ICU is talking about there's no quality of life, or, when they're talking about a meaningful recovery, well, what's meaningful is up to you, not to ICU, right? Because you can now glimpse into the other world, how we provide intensive care at home, which is what many ICUs may know in theory, but have no idea about our client's life at home in practice. Now, some ICUs, depending on where you are, they have staff working in ICU that also work for us. They are perfect to bridge that gap, So let's look at safety, quality of life, and again, let's look at reduced infections. Again, when we talk about safety, there's a few aspects here that I'd like to mention. Number one, we have by now provided millions of hours of intensive care at home. We've been in business now since 2012. And some well-meaning people told me at the time, well, don't waste your time. Nobody will ever pay for this. Well, I believed otherwise. I obviously believe in intensive care at home wholeheartedly, right? And it's a concept that I've been familiar with for over 25 years now. And it's a winning concept. It's a concept that, families definitely embrace. Clients embrace it. Some ICUs have embraced it. Our staff have certainly embraced it, coming from ICUs as CCRNs, right? And it works. It works without the shadow of a doubt, right? And we've saved the healthcare system millions and millions of dollars in the pursuit of intensive care at home, in the pursuit for providing quality of life for our clients and their families. So again, I can't stress enough that intensive care at home is nothing but a win-win situation. Also, like I said, not only have we adapted ICU policies to an intensive care at home environment, out of that also came third-party accreditation for intensive care at home, right? And no other service provider, besides services in Germany, which is where I worked with as well, have achieved third-party accreditation for intensive care at home in the English-speaking world, because it is quite a unique skill set, and it takes years of practice, and we're constantly learning every day, constantly adapting to what our clients want, need, and desire, right? So just coming back to infection rates again, at home infection rates are dramatically lower than in any hospital ICU. We've seen families reclaim their lives. Parents, spouses, and children spending time together without constant hospital alarms and visiting hours. I also want to mention here that, for example, during COVID, not one of our clients ended up with COVID. And that is in spite of our staff working between ICU and our home care environment during COVID, right? Because we know how to provide infection control safely, right? And what I also want to stress here again is that quality of life at home improves dramatically. And I'm not exaggerating for 1 minute here. Again, if you've been exposed to ICU, whether as a patient or as a family member, especially long term, there is no quality of life in ICU. There simply isn't. You know, there's noise, there's people talking 24/7, there's lights going on and off 24/7, so much more controlled at home. Because families sleep in their own beds, in their own rooms. You can engage in your daily routine at home, which is coming from you to us, and we deliver on that. It's not coming in an ICU. It's the ICU's routine. It's not your routine. At home, it's your routine, right? No more hospital infections at home. And care is personalized 24/7, right? Again, not only will we work with creating a care plan with you that works for you, so we'll be guided by you, but also we're working with a team that you help us select, you know, people you eventually know, like, and trust. You know, you want a team at home that you know, like, and trust, that you know has your back, right? And that's truly intensive care at home, ICU level care at home. And it's the future of long-term ventilation, tracheostomy, and anybody with complex care. The future here is not with disability support workers, let alone with general registered nurses. So if you're watching this and your loved one with cerebral palsy is in ICU and you're told they need a tracheostomy or BIPAP long term, you should reach out to us at intensivecareathome.com, you know, so that we can answer your question. Also, if your loved one has been told they need long-term ventilation, but the ICU team thinks it's quote unquote not in the best interest for your family member to have a tracheostomy, I urge you to reach out to us as well. We have helped many families in intensive care to advocate for tracheostomy for the right patient. Sometimes we advocate against it, you know, if we think that patients can be extubated, but we've also advocated for it when we think, you know, there's enough evidence that a tracheostomy is the right next step and that a tracheostomy will help your family member to go home and live at home, right? Now, I also want to heed a word of warning here, right? Last year, we had a cerebral palsy client at home, and this young girl was BiPAP dependent. She didn't have a tracheostomy, right? But she was heavily BiPAP dependent. She was on high flow nasal prongs as well, high flow nasal cannula with the Airvo machine, and was up to 15 liters of oxygen dependent, right? And we advocated for an independent nursing assessment. The lady needed NDIS funding for 24-hour critical care nurses. And it was clear from the reports that we had from our nurses that were doing some shifts there, but not enough, not 24/7, not many. There were disability support workers there most of the time, which we knew was unsafe because she had a lot of hospital admissions. And then we pushed and advocated for 24/7 critical care registered nurses due to her cerebral palsy, chronic lung disease, BiPAP dependency, recurrent desaturations, and complex medication needs. Unfortunately, we had, despite the strong evidence-based recommendation from an independent, very experienced critical care registered nurse and legal nurse consultant, who clearly demonstrated in her independent assessment that this lady needed 24 hours critical care nurses. The NDIS clearly ignored the assessment, and the client tragically passed away at a very young age, an absolutely preventable death, highlighting the systemic failure of the NDIS to provide evidence-based care for high acuity NDIS participants. Now, I will say this is the exception, not the rule. Most of our cerebral palsy clients have 24-hour nursing care through the NDIS. And part of the issue there was also that the family was intimidated by the NDIS, which really cost their daughter's life. And that's extremely sad. And you cannot be intimidated by anyone, right? The minute you're intimidated by anyone, you're on a downhill slope, right? So also, what was a big issue is that the Cerebral Palsy Association at the time did not advocate for the client. And I've got evidence for that, and I do believe it needs to be mentioned publicly here, because the Cerebral Palsy Association has let this client down, just as the NDIS has let this client down, and that's why she passed away. We've obviously lodged it to the NDIS Quality and Safety Commission as an incident, even prior to this lady passing away. That, I put on an incident in May last year where I clearly highlighted to the NDIS that if they're not funding 24/7 critical care nurses, that this client will be at risk of dying. Unfortunately, my prediction became a reality. I am a clinician after all. And then we obviously lodged the incident again when she passed away, and all incidents were closed with no accountability, right? And I do believe that, the bureaucrats at the NDIS are responsible for this death, and I hope they sleep well at night. I hope they sleep well at night. So, and it's a very serious and heartbreaking example that underlines exactly why evidence-based nursing care with 24/7 critical care nurses, CCRNs, is not optional, but it's simply life-saving. This lady had chronic lung disease, BIPAP ventilation, had an independent nursing assessment, like I said, prepared by a very experienced critical care registered nurse consultant, who's also a legal nurse consultant. And that assessment, which clearly outlined her need for 24/7 CCRNs to manage her ventilation, airway, and seizures, was ignored by the NDIS. Despite all the non-ambiguous evidence, despite the clear documentation of risk, the client passed away because she didn't have the level of nursing care that she needed to support her condition and keep her alive. And that was completely preventable. So, if you have also, so to speak, support bodies like Cerebral Palsy Association not advocate for the right level of care, you need to come to us. We've helped many clients, whether it's with MND, or with cerebral palsy, where we think that, the organizations are run by non-clinicians, with all respect, but non-clinicians don't really understand what needs to happen at home. They don't even understand what needs to happen in a hospital, because they're simply not clinical. They come from a supportive place, but again, the biggest challenge for those organizations is also that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't have the right network to make things happen for those highly vulnerable clients. So the independent nursing assessment for this client clearly showed that without 24/7 CCRNs, her desaturations, aspiration risks, and complex medication regime could lead to respiratory arrest, and tragically, that's exactly what's happened. That's why we advocate so strongly for evidence-based home CCRN nursing care under the NDIS, following the evidence-based mechanical home ventilation guidelines that, once again, you can see and find on our website at intensivecarehome.com. This particular story for this particular client must serve as a wake-up call. The NDIS must start funding 24/7 critical care nurses for all participants with tracheostomy, BiPAP, and high-intensity care needs, not after they die, but before, when it still matters. Like I said, I hope that the NDIS planners that were involved at the NDS sleep well at night. I hope that the Cerebral Palsy Association sleeps well at night, the people in charge there. I have emails with supportive evidence that we advocated for 24/7 intensive care nurses for the client, where the Cerebral Palsy Association has said, no, this can be done by support workers. Again, the blind leading the blind. And there's a good chance that if you engage with the Cerebral Palsy Association, if your family member is complex, that they will tell you the same, and that your loved one is at risk of dying. I encourage you to reach out to us here at intensivecareathome.com. You have nothing to lose. We have so many case studies, whereas the Cerebral Palsy Association may not have as many case studies as they would like, because, again, the blind leading the blind. So, and this is why we do what we do here at Intensive Care Hotline and Intensive Care at Home, making sure families in intensive care and at home get the right information and the right care before it's too late. If your loved one is at risk or currently in ICU with cerebral palsy, tracheostomy, or BIPAP, reach out to us at intensivecarehotline.com or intensivecareathome.com. We can help you get 24/7 ICU nurses at home, keep your loved ones safe, and avoid another preventable tragedy, right? And like I said, we're also providing level 2, level 3 NDA support coordination to help you with the funding that you need or your family member needs. So now I need to wrap this up now. I hope you've got some value out of it. If you like my videos, subscribe to my YouTube channel, click the like button, click the notification bell. Most of all, share this video with anyone that will benefit from it. You can share it with other families who have family member in intensive care or potentially at home with cerebral palsy, but don't have enough help. Maybe they get told by NDA support coordinators or by hospital coordinators there's not enough funding. Forget all about that. We wouldn't exist if that wasn't the case, right? And yeah, I'm going to wrap this up here. If you have any questions, now is your last chance to connect with me live here on the StreamYard link or type a question in your chat pad before I wrap this up. I continue to do these YouTube lives every week, every Sunday, 10:30 a.m. Sydney, Melbourne time, which is from next week onwards, it'll be 6:30 p.m. Eastern Standard Time in the US or in North America, which will be 3:30 p.m. Pacific time on a Saturday in the US. And it'll be just 11:30 p.m. on a Saturday night in the UK when I run these YouTube lives. So that's it for today. That's it from me. Like, comment, subscribe. I wish you and your families all the best. Take care for now.